Assalamu alaikum. I am Dr. Nilufar Fatema, going to present objective evidence of pulsus alternans by echocardiography in heart failure with reduced ejection fraction. Severity of the heart failure with reduced ejection fraction is identified by clinically by NOHA classification. Color Doppler echocardiography is the key investigation to detect the reduced ejection fraction. It includes ejection fraction less than 40%. Simpson method is the gold standard for calculating the ejection fraction. And we, if the ejection fraction 40%, then we say it mark it like moderate LV systolic dysfunction. And if the ejection fraction 30%, less than 30%, then severe LV systolic dysfunction. Most dangerous complication of this group is refractory heart failure, repeated hospitalization for that, and arrhythmia and intracardiac thrombus formation. Pulsus alternans is the arterial pulse with alternating strong and weak beat, which is found in heart failure with reduced ejection fraction. It is the poor prognostic sign for this group of patients. And we can document these pulsus alternans by catheterization and arterial pulse wave tracing. And this is the study, my study design is a cross-sectional study. The NOHA class 3-4 patients were included and who came to CCU. And color Doppler echocardiography done who have reduced ejection fraction, 100 patient was taken. It is done in 2018 to 19. Age group is 18 to 70. And the non-consenting patient and frequent PVC with bigeminy and atrial fibrillation are excluded. And ethical clearance is done by the review board of Bangabandhu Sheikh Mujib Medical University. And gender distribution, male are predominant here, 79 patients. And pulse, most of the patients were tachycardia. And pulsus alternans was found in 32 patients, and blood pressure hypotension is more prominent in this group. And most of the patients came with ST elevation MI, non-ST and ST elevation MI. And ECG finding, anterior MI was found more, and then next inferior ST elevation MI. Ejection fraction less than 30% or more, it's 87%. And mitral regurgitation, severe mitral regurgitations group are more, it's about 70 patients, that is 80% of patients. So it is one of the case, a 65 years male patient who has anterior MI and ejection fraction was 26%. And which is declared by Simpson method, and you can appreciate the pulsus alternans, which is documented by echocardiography in mitral valve Doppler imaging. It is alternative, weak and weak and strong Doppler signal. And this is another case who has 59 years, inferior septal akinesia. This patient also has RV infraction, and his TAPC was 9 millimeter, and he has moderate tricuspid regurgitation. And you can appreciate here the alternative Doppler signal in tricuspid valve, which shows the Doppler alternans. So our finding by color Doppler echocardiography, similar Doppler peak in every beat in about 49 patients among 100, and Doppler alternans in mitral peak gradient is 38. And in RV systolic dysfunction case, it's 19 case, and Doppler alternans found in 11 patients. So, and in LV, 38 patient was diagnosed by Doppler alternans, but pulsus alternans in that patient group only 32. So 6 patients were we have missed clinically to detect pulsus alternans. So there is a significant p-value. This is the summary of the result. And my conclusion is pulsus alternans is the poor prognostic factor for heart failure with reduced ejection fraction. Doppler alternans is the objective evidence of pulsus alternans by echocardiography, which is non-invasive. And variation, there are some variations, left ventricular alternans, right ventricular alternans, and biventricular alternans. Early recognition of the Doppler alternans can aid hospitalization, appropriate management, and intervention. It may change the prognosis. Thank you all for patient hearing.